The Effectiveness of Treatment on Social Phobia in Adolescence, created by myself, Riley Young, with the assistance of Dr. Danik. If you have any questions, please contact me at riley.young@link.edu. Why should you care about social phobia in adolescence? Well, because 3 to 15% of children experience social phobia, which makes this study important, especially when you consider they're also dealing with puberty and trying to form social relationships. A phobia is an overwhelming and unreasonable fear that lasts for at least 6 months. It is a fear of objects or situations that pose little real danger but provoke anxiety and avoidance that severely impacts a person's ability to function normally at work, school, and in social situations. Social phobia is the distress of engaging with people or being in a social situation. According to the DSM-5, people with social phobia experience fear of being vulnerable to scrutiny from others and a perceived negative evaluation from peers, which often causes extreme emotional anxiety. In children, social phobia manifests as crying, tantrums, freezing, clinging, and failing to speak. Children with social phobia struggle with low self-esteem, social isolation, inadequate social skills, poor academic work, and physical problems. The purpose of my study is to discern which treatment will be the most effective in lowering social phobia symptoms in adolescents. The 3 groups in my study are Treatment 1, Treatment 2, and waitlisted. The subjects who were waitlisted received the treatment proven most effective at the end of the study. Treatment 1 was CBT. CBT stands for Cognitive Behavioral Therapy. It is a type of talk therapy where the individual learns, with the help of a therapist, to control negative thinking and effectively deal with stressful situations, such as dealing with past trauma. This treatment is a popular method for mental disorders such as social phobia and has proven to be effective. It is also used to aid those with schizophrenia, PTSD, or sexual disorders. Treatment 2 was parental involvement. How parents raise and treat their child can have a long-lasting impact on the child's mental health. Rejection and criticism can have profound negative effects on a child, such as trouble with social relationships later on in life. We hypothesize that cognitive behavioral therapy will be more effective than parental involvement therapy in treating adolescents with social phobia. We will employ a between subjects and multi-level design to test this hypothesis. Participants were made up of 150 11 to 18-year-olds. There were 75 boys and 75 girls. They were recruited through referrals from community organizations with parental consent. Those diagnosed with any other psychiatric disorder other than anxiety or depression were excluded. The participants were randomly assigned to one of the 3 groups: CBT, parental involvement, and waitlist. There were 12 therapists, 6 men and 6 women, and each therapist was assigned to an equal number of children. Neither the child nor the parent was aware of what group the child was assigned. Once participants were assigned to groups, surveys and questionnaires that assessed the participants' levels of anxiety and depression were administered. Therapists observed the subjects before answering questionnaires of the Hamilton Anxiety Rating Scale and the Hamilton Depression Rating Scale, while participants self-evaluated using the Beck Anxiety Inventory and the Beck Depression Inventory. These materials were given before the treatments began, right after treatment ended, 6 months later, and the last was given 12 months after the end of the treatment. After the materials were administered, treatments began. Each participant received sessions across an 8-month time span. Each session lasted 1 hour and occurred twice a week with the assigned therapist. Each assessment data was collected, and after the very last assessment of questionnaires and surveys occurred, all of the data was collected and entered into a program. And one way Anova was implemented. And Anova was appropriate for this study because the data from the three groups needed to be compared. And Anova is equipped to run comparisons on more than two groups. Other tests, such as a t-test, would not. A one-tail ANOVA is the most appropriate compared to the two-tail ANOVA because it allows for stronger statistical testing while still using the same significance value of a t-test. The hypothesis was supported by the data. Cognitive behavioral therapy is more effective in relieving the symptoms of social phobia in adolescence than parental involvement was. Mental health is becoming a more widely accepted topic. Awareness of mental health concerns like social phobia is promising for acceptance, tolerance, and much needed research.